You know, one of the things I've heard you talk about, and I'm really curious about this, what does practicing a meat and potato dentistry mean? What's this meat and potato stuff?
Okay, meat and potato dentistry. Well, that's my name for the routine, common procedure, mix of services the typical patient wants. My practice was not a high-end cosmetic or full-mouth rehab business. It was not what the majority of what my wonderful blue-collar patients requested. While I did selective challenging cases, I brought in an oral surgeon to help me with the implant process, and an orthodontist as well to help me grow my young people part of the business. We were a family practice, and as such, we served moms and dads and their kids, along with the grandparents and neighbors. So nothing fancy, yet extremely personalized, relationship-based care. And our patients were, we gave them full, comprehensive evaluations and treatment plans, and then we gave them full authority to determine if they wanted some, none, or all of what we recommended. So in some cases we phased our care as well so that they did not have to feel pressured to have to do something. So I learned that the scar of the unchosen surgery heals slowly. I didn't want to push people into things. So we did basic, solid, caring dentistry. And for those dentists who can do the big restorative and cosmetic cases, we referred all of our tough ones out.
You had a really energized and I would say a very practical, caring dentistry practice. So I'm curious about something. Tell me, Dr. Ron, what is one tip that you would give to someone starting out on his or her own private practice?
Well, I believe I shared I would start with the end in mind. It's a Stephen Covey mindset. I wish I'd been smart enough to come up with that on my own. But I'm coaching right now, for instance, a young starting pediatric dentist. My first bit of coaching was to get him to dream and to envision what he wants. What will make the biggest difference, and yet one of the toughest things to implement into the head and the heart of a new dentist, and probably a lot of current dentists, is to identify who you are via your own core values. When they write them out, get them on paper, and list what they stand for, they then can take the next step to write their personal and practice vision statements. So think about this. Armed with their core values and their vision statement, well, the strategic plan magically begins to unfold as for any time they get stuck. All they have to do is refer back to their values and their vision. So above all things, this is what I want for new dentists. My fear, however, after talking to junior and senior dental students, they won't take the time or devote the seriousness to this process. I've seen the results with many of these doctors. Frustration, lack of direction, financial chaos, marital issues, misplaced arrogance, and unhappiness in their lives.